Hello everybody and welcome to the Thursday edition of Video Clips, and a couple of announcements first. On the Make Americans Free Again website, our legal center, where we're trying to gather up all the lawsuits that have been filed so that lawyers can find each other and people can find out what's going on with lawsuits, and we have them all posted there, all the ones that we can find. The Good News Center, we try to post something every day or two that is encouraging, and there is a lot of encouraging stuff going on around the world, so we try to focus a little bit on happy things. And then our Homeschool Resource Center, I know a lot of parents have sent their children back to school and decided to pull them out again when they saw what the environment is like, so visit our Homeschool Resource Center. It's all free, and if you even need more help because you have a special needs child or something going on, we have coaches who are willing to work with you to make that happen. A couple of other things. We have three psychology support groups right now. We make this very inexpensive, delivered by telephone. We have a group for depression and anxiety for adults. We have another group that meets weekly new group for people 15 to 20 years of age. Adolescents and young adults are having a terrible time during this period of time too. And then we have one that's specifically COVID related for people who are dealing with issues that really are specifically COVID, job loss and unemployment and businesses closing and school issues, and just even some of the rearranging of friends and family over this issue. So if you're interested in those, we have member and non-member prices. It's the cheapest therapy you're ever going to get. We're doing it at the best we can to make everything affordable around here. And those of you who are in Central Ohio, stop by on Tuesday nights. We have something going on here every Tuesday. A lot of them are cooking classes with our new dietitian, Nate, and we'd love to have you come and enjoy some food with us and say hello and congregate a little bit, okay? And then don't forget, fall semester starts this week and next week, and if you're interested in careers, my email address is pampopper@msn.com. Also, if you want to participate in our Make Americans Free Again conference calls, I'm scheduling at least a couple every week. All right, so I have a lot of things to share with you from our national experts, the Centers for Disease Control, the World Health Organization, Dr. Birx. So let's start with Dr. Birx, and let's see what Dr. Birx has to say today about the COVID-19. So according to her, she was visiting Alabama, and while she was there, she said, Americans are tired of COVID-19 and they're not willing to commit to a long-term battle. She says, we're just going to have to give people a timeline that's manageable. When Americans are told we could be living with this virus for years, their response is often, Birx says, I can't live like this for years, and they're willing to give up. Even those most at risk because of health issues are struggling, she said. She reports having talked to a nursing home resident in Oklahoma, and what she said was, we can't keep this up. If you give us a timeline, we may be able to hold on another 2 to 3 months. We might be able to hold on until the holidays, but you can't tell us that this is going to go on like this to 2021. The sentiment is shared by others, Dr. Birx added. I've been so struck by the number of Americans across the country that have just had it. It seemed to be surprising to her. Mortality decreases, this is the punchline of all of it, have also complicated matters, she said. Quote, when people start to realize that 99% of us are going to be fine, it becomes more and more difficult to get people to comply. Great words from the scarf lady. So she goes on to talk about later in her comments in this article why we're not doing as well as the rest of the world. It's just the fact that Americans value their freedom. If we were just a little bit more willing to sacrifice, we'd all be better off. But you know, it's a little bit hard to get people to comply when they know the truth about something. Doesn't that just speak volumes? All right, so now let's talk about the Centers for Disease Control. There's been a lot of discussion about the definition of cases and even death, and the Centers for Disease Control has issued several sets of guidelines, and some of us have been critical of these guidelines, which have included things like, quote, in cases where a definite diagnosis of COVID cannot be made but is suspected or likely, it is acceptable to report COVID-19 on a death certificate as probable or presumed. Well, probable and presumed are kind of problematic, and I've covered this in other video clips where you've got different states reporting differently, and then they adjust their numbers, and then this compilation is done by the CDC, and it's just a gobbledygook of numbers when it comes right down to it. And then somebody will report that a case of motorcycle death got categorized as COVID-19, and then they go change it, and you just wonder how many they're not changing because nobody really knows what happened. In April, Mr. Fauci brushed off all the questions about the deaths being padded as yet another conspiracy theory that should be ignored. You might remember the Emperor of Washington, Jay Inslee, when he was accused of padding the numbers, said it was nothing but a conspiracy theory from the planet of Pluto. He's such an infant. But as it turned out, it wasn't a conspiracy theory from Pluto. It actually was going on, and he wasn't even embarrassed when he announced that they were going to true up their numbers. It's astounding to me. So anyway, the bottom line is that there's a financial incentive, and it was first identified by Scott Jensen, who reported Medicare has determined that if you have a COVID-19 admission to the hospital, you get paid $13,000. If you put them on a ventilator, it goes up to $39,000. So that's an incentive, and he was concerned about it. Now, another incentive, Centers for Disease Control head Robert Redfield admits that financial policies may indeed have resulted in artificially elevated hospitalization rates and death toll statistics. As reported by the Washington Examiner on August 1, quote, Redfield agreed that some hospitals have a monetary incentive to overcount coronavirus deaths. I think you're correct in that we've seen this in other disease processes too. And he goes on to say that during the HIV epidemic, somebody may have had a heart attack but also be HIV positive. The hospital would prefer the HIV classification because there's greater reimbursement. He said that during a House panel hearing, when asked by one of the congressmen about potential perverse incentives. He continued, so I do think there's some reality to that. When it comes to death reporting, ultimately it's how the physician defines it in the death certificate, and then we review all of the death certificates. So I think probably it's less operable in the cause of death, although I won't say there are not some cases. I do think, though, that when it comes to hospital reimbursement issues or individuals that get discharged, there could be some play in that for sure. He'll just do anything but come out and admit that there's something seriously wrong here. Brett Giroir with the U.S. Health and Human Services Department also believes that financial incentives have been a problem. He told lawmakers that the statistics that HHS has been receiving from states are overinflated. So the bottom line is that the Centers for Disease Control chief, Robert Redfield, has admitted both to the press and to Congress, a panel of congressional leaders, that there is a perverse incentive for coding cases as COVID-19, and I've reported that in the past too. So I've reported on the tests being a problem. I've reported on the financial incentive to code things incorrectly. And then the last thing that has been discussed quite a bit is this issue of all of a sudden we've shifted from hospitalizations and deaths to talking about cases as if a case is a problem. So just a case isn't the issue. It's how many people have severe symptoms or die. And so can you imagine how crazy it would be if every 5 minutes somebody was telling you how many cases of the common cold everybody had? Who's dying of the common cold? And it's the middle of the summer here. Our emperor doesn't even talk about deaths anymore. He's talking about cases. And how he's getting his cases, well, gosh, I talked about that earlier in the week. Now here's another Centers for Disease Control directive. For months, the CDC has told travelers to quarantine for 14 days following international travel and travel to areas with the highest level of coronavirus transmission. So what's now happened is until early August, you were supposed to do this for 14 days, but last week the CDC updated its travel quarantine guidelines and now advises that following a trip of any kind, travelers should just follow many of the same precautions they apply during their day-to-day lives to prevent the spread of COVID-19. So they just changed their mind. Now, what's going to be interesting is to see if in response to this change of directions from the Centers for Disease Control, the states are going to change anything. So right now, states in the U.S. that have a quarantine requirement are Hawaii, Alaska, New York, New Jersey, Connecticut, Maine, and Massachusetts. And then the list and requirements and how many days and reporting and all that kind of stuff change. Whatever. And I said earlier in the week I wasn't going to put links and provide references because this changes all the time. And then in Hawaii, even the definition of quarantine is different. So in Hawaii, you have to be in your home or accommodation and not go to any public place, not a pool or a spa or a bar or a shopping center, local attractions. Food has to be delivered. You can't go anywhere from food. And then they've arrested visitors for not doing this. So the penalties are pretty significant. The UK says if you come from countries and territories that aren't on the list of exempted countries, you have to quarantine for 14 days. So we'll see if the CDC's directive on this translates down to the states. But they've just changed their mind. And then they changed their mind on something else too. So the CDC says, we've spent all these billions of dollars testing people. I talked about that before, right? And so now they're saying if you don't have symptoms, you don't need to be tested, okay? This even includes people who've been in close contact with somebody who is infected. It's a complete about-face because before this, they said that testing was important for both symptomatic and asymptomatic people to control the spread of the virus. Of course, the pandemic believers are apoplectic and continue to state that those who don't have symptoms are spreading the virus, even though the evidence is clear that it's not the case. And so I'm going to talk about a study here, how our emperor here in Ohio is getting his cases and hospitalizations is knocking on doors and random testing, then testing everybody coming into the hospital. So anybody who's in the hospital for any reason who tests positive is a COVID hospitalization. And our CDC director has said there's a perverse incentive for doing that, financial incentive to drive that kind of behavior. So the bottom line is that, what do sensible people do? Sensible people who are sick stay home. And by the way, what I know about the flu, I've had it 3 times in the last 25 years. I had no desire to leave the couch, let alone go to work and go shopping and go out, right? So I don't think you have a whole lot of problem with people who are really sick with the flu being out and about. But what about the people who've contracted the flu and their immune systems clear it without symptoms and that sort of thing? So I found a study of 3,410 close contacts linked to 391 known cases tracked between January 13th and March 6th. And here was what the researchers reported. The spread was lower in healthcare settings and on public transportation, the opposite of what you would think. The spread did increase with severity of cases. That's pretty much expected. The secondary attack rate was less than 4% among close contact with people who had COVID-19. That's not a lot of spread. It was 10.3% in household contacts. In fact, within household was the biggest source of spread, which is understandable. If I have the flu and I live with 6 people, I'm highly likely to infect the people who I live with, and then we all end up staying home, all right? So it's not being out and about. It's not going to get groceries today that's causing the problem. Asymptomatic carriers were not likely to infect close contacts, and that included the people that they lived with. Coughing increased the risk, obviously. That makes sense. But anyway, as it turns out, the World Health Organization says that asymptomatic cases, people, are not the main cause of spread. So so this is just what's so confusing about all of this, because I like to think I'm a fairly intelligent person, and if you tell me something that makes sense, I'll go with it. I'll verify it first, because I think that's just something that you do. So the World Health Organization says that asymptomatic people don't cause spread. The Centers for Disease Control says, yeah, they do. And then the World Health Organization's changed nothing. Now the CDC says, no, they don't. No reason to test an asymptomatic person, even if they've been close to a person who's infected. Studies show that the spread is most likely to happen at home, yet we hear all about this. You got to wear masks every time you go outdoors, and et cetera, et cetera. But, so which do you follow? I guess you pick the version that you like. I like the World Health Organization version of this. I like the CDC's version of this. Am I going to put a link here or send you a link? No, because by the time that you ask for it, they'll probably change their mind again. And I think I don't know if they do it deliberately to keep people kind of unhinged. or if they've just, maybe they can't even remember what they've said, and maybe they're getting exhausted from this. I've thought about what would motivate Deborah Birx to actually say in public, well, now that people are finding out that 99% of us are going to survive, it's hard to control people. What would make somebody say that? Just so exhausted from the whole ordeal, or just the assumption that everybody's so stupid that you don't even have to be careful what you say anymore. I don't know what it is, but I think that thinking people know something is terribly wrong here. All right, makeamericans.freeagain.com. Our company website is wellnessforumhealth.com. If you like what we're doing for you, buy stuff from us. There's no donate button. I've been really clear on the Make Americans Free thing. makeamericans.freeagain.com. We want the money that you're investing, if you are doing that, to go to the local groups that are working to help you too. We don't want to take that money. We'll take care of ourselves on that site, and if you can afford to and you like what we do, buy something from us, no obligation, of course. As usual, pass this on to people who you think might enjoy watching it and learning the truth about all of this, and I'll be back to you tomorrow with more news.